Okay. Guys, for today our presentation will be on the epilepsy. Before going to the epilepsy, we should know the difference between the seizure and epilepsy. What is the difference between seizure and epilepsy? Anybody?
Epilepsy is a disorder. Seizure is a symptom.
No. Seizure is also a disorder. No.
Epilepsy consists of many seizures.
More than one episode.
Seizure is
It's a single episode.
Okay.
Basit has told it's a
Yeah.
more than one attack.
The more than one attack of seizure is epilepsy. Now, if you guys are now doctors, a patient comes to you, you took his history and he says that he had one episode of seizure. One episode of seizure. Did you take this as an epilepsy or just a seizure?
Epilepsy.
चुप कर।
क्या चुप कर?
once more.
Okay, a patient comes to you, you took his history, and he said that he had just one attack of seizure. Okay, did you take this patient as an epileptic patient or just a seizure? Because you said the epilepsy is the recurrence of seizures, but he had just one episode of seizure. Okay, is this patient an epileptic patient or just it is a common seizure?
Epileptic patient.
तू चुप कर।
मैं क्यों चुप कर?
हैं? Why?
Because epilepsy, there will be recurrence. No, there.
But you don't know the second seizure will be coming.
So we'll observe.
So for now,
How much? For how much
We have to
time?
observe for his next
Next attack.
Next attack.
Till then,
And then we consider
next seizure he may die. He may be driving a car and he will have a panic attack.
I won't let him. I'll keep him in the hospital.
He is possessed.
The thing is, you have to give a drug, broad spectrum drug. Okay, broad spectrum drug for seizures or epileptics. I will tell later what the drug is.
As of
So for
you-
now, you will take them in the first attack, in the first seizure. You will take it as an epileptic patient, but you should not go for the treatment of epilepsies because there are drugs for the epileptics. They have cardiotoxic effect. If you give a prolonged drug for non-epileptic patient, it may cause damage. So rest.
So any seizure is an epilepsy.
Any seizure first for instance is taken as epilepsy. After discovering
For
of
example, you have to consider a patient if he has a seizure attack, you have to consider it as epilepsy. But after performing the further investigations, then you have to rule out. You have to make a diagnosis whether he is really an epileptic
That
on the
means
basis of
if
different.
If he has the attack of seizure for the first time, we will consider it
As an epileptic attack.
It's an epileptic attack.
Yeah.
But then we will not give the treatment for epilepsy.
Yeah.
Just a broad
Yeah.
spectrum treatment.
First of all, we have
For-
to confirm
for the
whether
instance.
he is really an epileptic patient or not.
Okay. Before going to the topic, we should have the broader look of the neuroanatomy. We have already studied in the previous semester the precentral gyrus and the postcentral gyrus. I will tell you the connection of these things with the epilepsy. Now Zubair will say a few things about the epilepsy. What you want to say?
Okay. So I'm gonna again restart the topic about the epilepsy. First of all, we must know the definition of epilepsy. There are different books and there are different literatures. They define it differently. For example, as Rouf told that if there is a patient who has recurrent episodes of seizures, definitely we are going to treat that patient or we are going to consider that patient as an epileptic. But in Davidson it's written that if a patient has one seizure attack and in addition to that if he has a cortical lesion, please try to understand, if you find a cortical lesion plus one seizure attack, it is also considered to be an epilepsy patient. And before going forward, what actually happens in the epilepsy? See, our brain, as far as pathophysiology of the epilepsy is concerned, we know that we have got two types of neurons. One is excitatory neuron and one type of neuron is inhibitory neuron. Can anybody tell me any example of excitatory neuron or inhibitory neurons? We have got different types of neurotransmitters. We have got excitatory and we have got inhibitory. Does anybody know any example of excitatory
Excitatory
transmitter?
is, I guess, acetylcholine.
Exactly, acetylcholine. But here we have got two types. One is GABA,
GABA.
that's gamma aminobutyric acid. It is an inhibitory neurotransmitter. Then, in addition to that, we have got aspartate and glutamate. See what happens in epilepsy. There is always a balance between this inhibitory and between this excitatory. And whenever this balance is lost in an epileptic patient, so it will cause epilepsy. What happens whenever the balance is lost? See, the understanding of a patient, his conscious levels, his behavior, the way he thinks, the way he perceives, the way he remembers things, this all is concerned as far as whenever there is balance, he knows his surroundings, to which things he interprets, the way he perceives things, smells, tastes, or identifies. This all is present whenever there is balance. If this balance is lost, he will have alterations. For example, accordingly, we have classification. For example, we have focal seizures and generalized seizures. Let's take an example. And these focal seizures, there are two types of focal seizures. One type of seizure is there is no loss of consciousness, but another type of focal seizures, there is loss of consciousness. So as of now, I will define these two types. This comes under focal seizures. We have classification, and there are two types. For example, one is called as partial seizure, simple partial seizure. One is called as complex partial seizure. See what happens in simple partial seizure. In simple partial seizure, there is no loss of this is an epileptic attack, but there is no loss of consciousness, and there are changes in his surroundings. He smells differently. His tastes are different. He may have certain psychological changes, but consciousness is not lost. But in complex partial seizure, he loses consciousness. He may have changes. For example, he may rub his hands immediately. He may have repetitive jerks. He may perform swallowing, repetitive swallowing. For example, you are sitting here, you don't have epilepsy. Why you will swallow? But he will swallow. He will rub his hands, and he will walk in circles. For example, he is walking in circles, but he does not know what he is doing. So this is complex partial seizure. These all come under focal seizures. So there are focal lesions. That's how there is difference between, you have to consider the balance. As I told you, there is inhibitory, there is excitatory. He loses this balance. That's why he is not able to understand what he is doing. He performs those jerky type movements, jerks. For example, like this, he will do like this. This is a jerky movement. He will have certain dancing movements also. These are all considered to be epilepsy. And whenever a patient loses consciousness in epilepsy, this is dangerous for a patient. And before going further, we will discuss the signs and symptoms of the epilepsy. The first sign is there is temporary loss of consciousness. The second is there is a staring spell. For example, he will stare in space, or he will stare at you without any reason, without showing any movements. He will stare at you like this for a few seconds. This is called a staring spell.
Has a unique name.
This is called a staring spell.
Versive epilepsy.
And the next is there could be a jerking movements in arms, as I told you, or jerking movements in legs. This is the next. And the next symptom is there could be psychological change. He may talk nonsense sometimes. That's also an epilepsy. The next thing is
Rouf. He talks nonsense sometimes.
and then we go forward. Whenever a person should seek a doctor. For example, if he has an epileptic attack which lasts more than 5 minutes. If a female is pregnant, she may develop a certain abnormal consciousness, or she may see change, she may perceive different surroundings. So she has to visit a doctor. This is the next condition in which a female pregnant. Or if a patient is diabetic, he has a seizure attack, he should